I have been at Mednex ever since I graduated from fellowship. I've been here since 2010 at the same place in San Jose, California. In terms of my education, I went to UCLA for my bachelor's degree, and then University of California in San Diego for med school. Pretty much a Southern California trained physician, and then went to USC, Los Angeles County Women's Hospital for my residency in OBGYN, and I finished at Yale for my maternal-fetal medicine fellowship.
Can you talk a little bit about how you got into medicine, if you were at all inspired by a woman to enter the field?
I've wanted to be a doctor ever since I was a child, and I honestly do not know what made me think of medicine other than I thought it was just the coolest thing to help people. It was, your typical childhood dreams. But in terms of a specific female physician that inspired me, I was one of the first to go to college in my family, so I was the first female physician in my family. So in terms of family and friends, I didn't really have the role models in medicine until I was in the medical career training and surrounded by other female physicians.
What do you think it means to be a woman in healthcare today?
I thought about that question for a long time, and I think first the fact that I have to think about that question and what it means, I think speaks to the fact that it speaks to the fact that all of the female physicians that came before me that kind of trailblazed this path, that they did a great job, because I don't feel unique because of my gender. I don't feel that I'm a minority or underrepresented, especially in my field of OBGYN, where our females are the majority, and it's actually the males that are underrepresented. Yes, when you get to the specialties of OBGYN, especially GYN oncology or maternal-fetal medicine, historically there are more men than women, but that's also changing as well. Okay, so I think that the fact that I don't really think about my gender is actually great. Now, my dean of my medical school, I remember Dean Savoya telling me she was one of 2 female medical students in her med school at Harvard. And so she obviously had a different experience than I did. And these are the women that we should be grateful for, so that, by the time I entered med school, it was pretty much even Steven in terms of being, the male to female ratio. And I didn't feel different just because I was a woman.
What are some of the challenges of being a woman in healthcare?
I think one challenge, I'm a mother of 4. I think one challenge is balancing, having a work-life balance, honestly. I think it's really difficult to balance. I think one suffers. And it's always a challenge to be good at everything, and figuring out, especially being a woman, being the gender responsible for bringing life. We have to go through pregnancy, we have to go through childbirth and the postpartum period, where our bodies go through multiple changes, but at the same time you have the same expectations to work and deliver the same quality of work. I think that's a challenge, honestly, and not feeling guilty about taking time off, and how you organize and plan your family life around your career, and how not to impact your fellow partners or your residency or your med school. I think that was one of my biggest challenges, and how to navigate all of that. And there's really minimal guidance. You're pretty much, you kind of see what other people are doing and you try to make the best decision you can. And some are not so great and some are okay, but it just, I think that's very difficult. And I think another challenge in being, what I see is that when you, even though in OBGYN, females are the majority, what you see, like when you look at our national leadership, American College of OBGYN, you look at Society for Maternal-Fetal Medicine, it's actually females are sometimes underrepresented in roles of leadership. So I think and perhaps it is because we have to divide our attentions, being a lot of us are mothers and those take our attentions, etc. Or perhaps it's because, MFM is still a young specialty in the world of medicine. And perhaps because of all of these things, it's going to take time for women to kind of really represent in all areas of leadership. I mean, there's great female leaders in ACOG and MFM, but historically, it's not even equally distributed, nor does it represent the number of females actually in OBGYN training versus the number of males. It's very skewed. I mean, I was in a residency training program with 12 residents a year, and so that's 48 residents at one time, and probably we had 2 men. So, but when you get to the levels of leadership, it is usually the other way around, not so skewed, but it's probably 60-40, who knows, but men are much more represented in roles of leadership than women.
And on that note, what are some of the positives that come from being a woman in healthcare?
Well, I think in my field, it just gives you some, obviously, you are able to perhaps understand some things a little bit better, and maybe it helps you to become a better clinician. Otherwise, I think, being a woman is the very best thing. So it can't be a weakness, right?
Great. What advice do you have for women who may be applying to medical school or entering the medical field for the first time?
It's the best job out there. You're making the best decision. Go for it. Don't let anything stop you, and do your best and do amazing and wonderful things.
How do you think women physicians can best support fellow women physicians?
Mentorship is definitely important, and I've had great mentors throughout my career, both male and female. But I think the female mentorship has been tremendous, and I think we need to, in terms of, Hillary Clinton wrote, it's a village to take care of children, and it's also in terms of you want to carry that forward in terms of training our younger generation of physicians, and have older female physicians mentoring, giving advice about balancing work-life, whether it's possible, what are the great ways to do it, balancing how you want to become, if you want to do research or be in roles of leadership and administration, how that path works out for you, and how do you devise a plan, and what is the best way to move forward. I think this is how we can help our younger generations and just kind of pass that baton along.